Hello, and welcome to another vlog. I hope everyone enjoyed the Super Bowl this weekend, even if you're like me and didn't watch any actual football. Anyway, this week's topic is borderline personality disorder. Tune in on Thursday if you want to see our educational video, which will talk about the condition in more detail. And don't forget to subscribe. Today there's a few things that I want to talk about. First, I want to talk about February, which is Psychology Month. I also want to talk a little bit about some common misconceptions related to borderline personality disorder, or BPD as I'll be referring to it for the rest of this video. And I also want to talk about some of the treatments for BPD. As I mentioned, February is Psychology Month. This is an annual awareness campaign that's organized by the Canadian Psychological Association that emphasizes the importance of psychology in our everyday lives because obviously mental health is very important to our everyday well-being. And so that's what this month is meant to address. So over the next few weeks, all of our videos will be about psychology. So we'll be talking about different types of mental illnesses and psychological concepts because I see this as a learning opportunity for all of us in which we can learn about the importance of mental health. And that brings me to the next item on our list, which is some common myths about BPD. Now, my cousin Melanie actually has borderline personality disorder, and she sent me a list of common misconceptions about the condition that she wants me to address. So I'm going to read what she wrote and debunk some of those myths right now. So here's what she says. The biggest myth of all is that people with BPD can't be admitted into the hospital because we will lose the ability to use skills and won't know how to. In fact, this is not true. Patients with BPD do not lose the ability to use skills when admitted to get psychiatric help. They can even teach parents with BPD skills on how to cope more with their BPD. Another big myth is that BPD patients use suicide for attention. Now, I'm not saying that there isn't patients out there like that. There's a lot of stigma around that, and that's not fair to the patients who actually are considering committing suicide and can't get help because of the stigma. If someone comes to you and wants to commit suicide, please talk to them and reassure that person that everything is going to be okay and listen to them. That is how we end the stigma around these things. Now, I just want to pause here for a second and reiterate the importance of getting help if you or someone you know is considering suicide or having suicidal thoughts. I can't stress this enough because this is crucial. So I just want to stress that before we move on. Another myth is that BPD patients are violent. No, we are not. Hollywood loves to show BPD patients violent, and it's really not fair. Everyone gets violent when they are picked on and on. That's just normal and natural. In fact, we are one of the most understanding, caring, empathetic, sympathetic, honest, trusting people. We go through a lot daily, and that's what makes us understand. We can easily take ourselves and put us in your shoes. That's how we understand. So I just wanted to thank Melanie for sending me this. I think it does a very good job of addressing some of those common misconceptions. And everything that I read was all in Melanie's own words. So again, I just want to thank her for sending me that. It's very informative. And this brings me into the third thing that I want to talk about today, which is some of the different treatments for BPD. Now, as you'll see in Thursday's educational video, there's a variety of different treatments, including psychotherapy and sometimes medication. But I specifically want to talk about a form of treatment called Dialectical Behaviour Therapy, or DBT. Now, this form of therapy was actually developed by a woman named Marsha Linehan, who's an American psychologist, back in the 1980s. And it's designed specifically to help manage borderline personality disorder, but it's also used for a variety of other personality disorders. And as you might see, there are some similarities between it and cognitive behavioral therapy, which we've talked about previously in this series. But of course, it is a completely different form of therapy, so please keep that in mind when we discuss it. So I'm going to go over some of the basic principles of dialectical behavior therapy, or DBT as I'll be referring to it for the next few minutes. Um, so DBT actually has three main principles. It's support oriented, which means identifying one's thoughts and building on them to help them feel better about themselves. It's cognitive based, which means identifying harmful thoughts, beliefs, and assumptions and learning new ways of thinking. And it's also collaborative, which means working closely with a therapist to help solve the problems associated with borderline personality disorder. And there's two main components. It has individual therapy sessions which emphasize the different problem solving skills, but there's also a group component which helps the participants to learn the specific skills from the different modules of DBT. And I'm going to talk about the different modules now because there's four main modules, which I'm going to go over briefly. Now keep in mind this is a very brief overview of DBT, so I encourage you to go and do some research on your own if you want to learn more. But hopefully this will give everyone a basic overview of what it is. So the four main modules are mindfulness, or living in the moment, interpersonal effectiveness, or interacting with those around you, um, distress tolerance, or coping with stressful situations, and emotional regulation, or recognizing and handling the different emotions. So I'm going to talk briefly about those different modules. So the first module is mindfulness. And this is divided into what and how. So what do I do to practice core mindfulness skills, and how do I practice core mindfulness skills? Mindfulness is basically a psychological concept which is all about living in the present. Um, so for the what do I do to practice core mindfulness skills? Um, According to the principles of DBT, you observe, describe, and participate. And how do I practice core mindfulness skills? According to DBT, you do it non-judgmentally, when mindfully, and effectively. Then there's the interpersonal effectiveness module. And so during this module, participants are meant to learn interpersonal problem-solving skills. So it's all about learning to ask for help, learning to say no, and learning to cope with conflict. And it focuses on situations where the objective is to change something. So the goal is achieved, and the relationship and the person's self-respect are left undamaged in the process. Which brings us to the third module, which is distress tolerance. And this is all about learning to tolerate stressful situations in a non-judgmental way. So it's to teach people with BPD to accept themselves and to accept the situation that they're facing. Because obviously not all difficult situations can be avoided. And then finally, there's the final module, emotion regulation. And this is meant to regulate one's emotions. So it's about identifying one's emotions and then managing those emotions properly. So those are the four basic modules of DBT. Like I said, this is a very, very brief overview of how it works. And obviously left a lot out. So if you want to learn more, check out some of the additional resources. I'll include a link to an article that explains DBT in a bit more detail, and also maybe do some research on your own time. Anyway, if you enjoyed this video, hit that subscribe button. Also, consider following Squeaky Wheel Productions on Facebook and Twitter. I hope you enjoyed this video and learned a lot from it. And I hope to see you on Thursday. Thanks for watching.